Hi, this is Dr. Leano. Suicide is the leading cause of death in age groups 10 to 44, which are the best years of life. Unfortunately, we cannot treat suicide. That is the problem. We cannot treat suicide, but we can prevent and treat thoughts of suicide and the act itself. There is a medication called ketamine that has a rapid anti-suicidal effects. Significant reduction of suicidal ideation after ketamine infusion was proven. Ketamine can improve your personal life and family life, your financial life and functioning, your professional life. Ketamine lowers the risk of suicide. Life is good. Life is waiting for you to enjoy it. We must compare 80% success rate after ketamine infusion versus 65% success after the use of traditional antidepressants. And even more important, a response within 1 day after ketamine infusion versus 6 to 8 weeks after those traditional antidepressants. But ketamine does not replace those antidepressants, but it may help reduce the dose of those medications the patient is taking and decrease the unwanted side effects. Ketamine is also effective in the treatment of PTSD, OCD, bipolar disorders, anxiety, fibromyalgia, alcohol and substance abuse, which is another form of suicide, intractable headaches like intractable migraines, CRPAs, neuropathic pain, and acute and chronic pain syndromes. So what is ketamine and how does it work? In a few words, ketamine is a general anesthetic that may reverse the loss of neuronal connections and brain atrophy, reversing symptoms of many mood disorders like depression. The administration of the infusion of ketamine requires the presence of a board-certified and experienced anesthesiologist. We don't want to repeat the experience with Michael Jackson. So it's important to have a board-certified and experienced physician anesthesiologist. There are some inconveniences with the treatment of the ketamine infusion. We need an IV placement. The insurance companies do not cover, so there is an out-of-pocket cost. The time of treatment is between 1 to 2 hours because the patient has to be monitored. There is the need of a companion that drives the patient back home the day of the treatment. And also at the beginning, there is a loading phase that requires treatment for 5 to 10 consecutive days. And later, there is a maintenance treatment every 4 to 6 weeks. So I am Dr. Leano, a board-certified anesthesiologist and interventional pain physician with more than 30 years experience with using ketamine. If you, a friend, a member of your family, or any person you know that is fighting with the risk of suicide, PTSD, OCD, major depressive disorder, bipolar disorder, alcohol or substance abuse, intractable migraines, CRPS or severe chronic, call Infusion Therapy for Life at 561-248-1166. 561-248-1166. We have a special offer today for the initial loading phase of the treatment. We are lowering this initial phase 25% until the end of the year. So this is 25% off for the initial loading phase of the treatment until December 31st, 2020. Life is good, and life is waiting for you to enjoy.